Hi, this is Maria Salazar with Unit 3 Urinal. Oh my god, I can't believe we're already on Unit 3. 7 more weeks and then I'll finish. And then after that I have one more clinical. So one significant event in my nursing career that impacted my understanding of the psychiatric mental health nurse practitioner occurred when I was caring for a young adult male diagnosed with schizophrenia. The patient was experiencing severe auditory hallucinations and paranoia, making him highly distrustful and agitated. You know, people who have schizophrenia, they usually have really bad paranoia. And that's something that I have learned with my 10 years of experience as a psych nurse. During our initial intercourse, he expressed fear that I was a part of the group conspiring against him. And he was reluctant to taking care of his medication, believing that it was poison. Sometimes they will think that the medication is poison. Sometimes they will think that the food is poison. Sometimes I have had patients that they will not eat unless the food comes in a package, like sealed package, and they're the first ones opening it. As a nurse, I initially felt challenged by the intensity of the patient's symptoms, recognizing my limitations and fostering trust in such a short time. However, I have learned into my strengths, patience. One of the best things that I have, and I could tell you, and that people could tell me all the time, is that I'm a very patient person. And when it comes to psych, if you don't have patience, this is not the right career for you. Empathy and active listening. One of the first things when I started working here that the CEO used to tell us was like, I work in substance abuse. So he was like, if you treat them like addicts, you're doing a bad job, because everywhere they go, they get treated by addicts. So you have to be the exception. You have to be the person that helps them and treats them better. And it's true. All my patients, for me, I treat them good, with respect, empathy, active listening by validating their feelings, maintaining a calm demeanor, and offering reassurance without dismissing their experiences. I slowly build rapport with them, making them trust me. Like every time I do the nursing assessment, that's the moment, that's the first encounter that you have with your patient, and that's when you build that rapport with them. The experience has deepened my understanding as a psychiatric mental health role, particularly in managing complex psychopathology. I realized that being a provider involves more than clinical knowledge. And it's true. It requires building trust, especially with patients who have difficulty trusting to their illness. I also recognize the importance of consistent therapeutic use of myself. My empathy and calm presence were in session, reducing his agitation, allowing him to engage in treatment. So it is very important for us to treat patients with empathy, respect, calm demeanor whenever they're experiencing this type of issues like schizophrenia, paranoia, them not being able to trust us, not because they don't want to, but because of their illness. So from this event, I have learned the significance of being fully present, emotionally grounded, and patient with the process of developing trust. In future practice, hopefully in a few months, I will continue to apply these insights by prioritizing rapport, building my patients, using empathy as a tool of engagements, recognizing the therapeutic relationships that I have built over time, especially with patients of severe illness that actually need my help. Thank you for listening to me, and I love sharing every day or every week. Thank you.